Don't be dirty, do be neat. Wash your hands for your SP. Oh, hey, I'm the SP Guru, and in this video, I'm gonna be talking to you about something that seems super simple, hand cleaning. But I bet even a hand washologist like yourself has even thought, what's the best method of washing my hands? What do I do if I contaminate my hands? When's the best time to be washing my hands? Well, in this video, I'm gonna be breaking down all of those things and much more. Come on, let's get into it. So, you're studying for your Step 2 CS exam, you're confident in your knowledge and you're confident in your skills. Then all of a sudden you walk up in front of your door and something happens. Whoa. When do I wash my hands? You panic. Something you've done your entire life suddenly seems strange. Well, hopefully I put your mind at ease, but first, I want you to take a look at two scenarios, and I want you to decide which one you think is best. Go, 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 go. Good afternoon, Miss Daisy.
Yes.
Hi, I'm the SP Guru in the clinic today. I'm going to be asking you some questions and performing a physical exam. Would that be all right with you?
Yes.
Excuse me while I wash my hands. All right. Now, how may I help you?
I'm having trouble swallowing.
Trouble swallowing? That must be
Yes.
very difficult for you.
It is.
I'm really glad you've come in so that I'm able to help you. How
Thank
long
you.
has this been going on?
2 months.
2 months. Miss Daisy, I have now finished all my questions and I'd like to proceed to the physical exam. Would that be all right with you?
Yes, doctor.
Thank you. First thing I'd like to do is I'd like to take a look at your eyes.
Doctor, you didn't wash your hands. And you're going to touch my face?
Good afternoon, Miss Daisy.
Yes.
Hi, I'm the SP Guru in the clinic today. I'm going to be asking you some questions and performing a physical exam. Would that be all right with you?
Yes.
Are you comfortable in this room?
I am.
Would you mind if I take a seat?
No, right ahead.
Now, how may I help you?
I'm having difficulty swallowing.
Well, I'm really sorry to hear that. It sounds very uncomfortable.
It is.
How long has this been going on?
2 months.
2 months. Miss Daisy, I've just finished all my questions. I'd like to perform my physical exam now. Would that be all right with you?
Yes.
Please excuse me while I wash my hands. So, which option did you choose? If you chose before your physical exam, you'll be correct! Now, the reason is, once you wash your hands, before you ask your questions, you then grab your clipboard and grab your pen and touch the chair. Then you're taking notes, and as soon as you transition into your physical exam, they're gonna make you re-wash your hands. And time is limited, so make sure you don't waste it. Now, another question I always get is, which method is better? Should I wash my hands? Should I use the gloves? Should I use the hand sanitizer? The truth is, there is no real right answer. They all will do the job. But I want you to be aware of a couple of things. First thing I want to mention is I always tell my doctors that I work with to make sure you use hand sanitizer. It is quicker and it is just as effective. But there are things that you need to be careful of. Make sure that you fully dry your hands. Otherwise, you could end up with this scenario. First thing I'd like to do... Yeah, we don't want any screaming ladies in our offices. So make sure that you thoroughly rub your hands really, really fast. We may look super silly, but friction is gonna be the thing that dries your hands the best. Now, once you get your hands clean, there are a few things that you need to be aware of. Make sure that you don't do anything like this.
Just stop. What are you doing?
Huh? Or this. First thing I'd like to do is I would like to untie your gown. Is that okay?
No, you're touching everything. Your nose and your hair, and you go put on new gloves.
Oh, okay. First, for the hand sanitizer to be active, you need to make sure that it is completely dry. If you use a paper towel to rub off the excess, you're basically wiping off everything you just applied. As soon as you touch your face, touch your hands, or your lab coat, your hands are decontaminated. You're like a surgeon getting prepped for surgery. Sterile hands, folks, sterile hands. Don't touch, don't touch. Now, if you're gonna be washing your hands, we need to be breaking down the appropriate amount of time you should be washing your hands, because this ain't cut. So come with me. Let's break down the appropriate amount of time to wash your hands. Now, you want to make sure you're washing your hands for an appropriate amount of time. So here's a little song you can sing to yourself while you're lathering your hands to know you've effectively done this. All the gurus wash their hands so they will succeed. Don't forget to lather and rinse. Now that is all you need. And go ahead and rinse your hands. And now your hands have been properly and effectively cleaned for an appropriate amount of time. Now leave the water running so that you can go ahead and grab your paper towel, dry your hands, and then shut off the faucet, because your faucet is considered unsanitary. Now, if gloves fit you better, pun intended, just make sure you pick the right size for you. Now, I'm a big guy, so I'll pick the large size. Now, there are some things that you do need to be careful about. There are things that can always happen. You can start to put the glove on and it breaks. Okay? Just grab yourself another glove, don't panic, and proceed like normal. Something that you could be doing to prevent your hands from getting contaminated while having gloves is to put 2 pairs of gloves on one hand. So that way, if you contaminate your hands, you take your pair of gloves off and you got a second pair of gloves underneath. Now, there is no right answer of what's the best method. Wear the gloves, wash your hands, use hand sanitizer, whatever makes you feel more comfortable when you're inside that room, so that you're able to find out from that patient what is going on and solve their problem. There are times that you do need to make sure that you do wear gloves. Now, for instance, if you got a patient that's bleeding or has any kind of leakage, you want to make sure you wear gloves for your protection as well. So, it's up to you to decide. But I hope this has helped you at least get an idea of what the proper ways to do these methods are, so that when you choose, you know and can have confidence within yourself that you're doing the right things. Keep studying, work hard, and you too shall pass.